From island roots to global impact, the Thalassaemia Story. In this episode of Cyprus Diaspora Uncovered, international speaker Maria Hadjidemetriou delivers a powerful lightning talk, highlighting the global impact of thalassaemia and the importance of raising awareness, advancing research and supporting those living with the condition. Inspired by the theme of International Thalassaemia Day 2026, from island roots to global impact, the Thalassaemia Story, the discussion explores Cyprus's significant contribution to the global fight against thalassaemia, while emphasizing the value of education, advocacy, and international collaboration in improving the lives of patients and their families. This lightning talk was recorded live at the Cyprus Diaspora Forum on May 8th, 2026 at the AMARA Hotel in Limassol, Cyprus.
Today is May 8th. It is International Thalassaemia Day, and the reason why we celebrate this day actually comes from a very sad journey of our co-founder and our president, Mr. Panos Inglesos. His son passed away May 8th. I think it was 1992, his son George. 1993, thank you. And he could have folded, but he forged forward instead and is a co-founder, along with a few other patients and parents, of Thalassaemia International Federation, and he's been holding the position as president. And just to tell you a little bit more about this inspiring man, he's a graduate of the University of London with a degree in economics and accounting, and the chairman and chief executive of a group of companies he established in 1961. His lifelong commitment to thalassaemia began in 1969 when his son, George, was born with beta thalassemia major. His personal experience led him to become deeply involved in supporting patients and parents in Cyprus and beyond. In 1986, inspired by the work of patient organizations internationally, Mr. Inglesos helped establish Thalassaemia International Federation with the aim of improving care, prevention, education, advocacy for thalassaemia worldwide. He was elected TIF's first chairman and is widely recognized as the founding father of the international thalassaemia community. Over the years, he has received numerous awards in Cyprus and internationally for his pioneering contribution in the fight of thalassaemia. So he is not with us today because his wife is in the hospital. So he had to go and be with his wife. We have Dr. Androula Eleftheriou. She is the executive director for the Thalassaemia International Federation. Dr. Androula holds a BSc, MSc, and PhD in biochemistry, microbiology, and virology from universities in London. She completed her postdoctoral fellowship at the Centers for Disease Control and Prevention in Atlanta, USA, and then received scholarships from Cyprus government, the World Health Organization, and Fulbright Commission. From 1990 to 2006, she served as the head of the Virus Reference Center at Cyprus Ministry of Health. She has worked closely with Thalassaemia International Federation since 1993 and officially assumed the role executive director in 2006. Through TIF, Dr. Eleftheriou has led major international initiatives, collaboration with the WHO, European Commission, scientific and medical associations, academia, and patient organizations worldwide. She has authored numerous scientific and educational publications and has served on several European and international health committees. Her work has been recognized with multiple awards, including the EHA Hemisphere Award in 2024, which is a huge acknowledgement. And finally, to my left, very special man, Dr. Michael Angastiniotis. He is a trained pediatrician, and he informally diagnosed me of thalassaemia when I was 2.5 years old. So our history goes back. So he is the medical advisor to Thalassaemia International Federation. He was born in Famagusta, Amochostos, let's say it, Amochostos, yes. and graduated in medicine from the University of Aberdeen in Scotland in 1966. He later obtained his diploma in child health from the Royal College of Physicians of Glasgow and received further training in pediatrics, genetics, hematology, oncology, and thalassemia. He has been involved in Cyprus' Thalassaemia Control Program since its earliest years in 1971, 1972, and has played a leading role in the development of thalassemia care, prevention, and medical record systems in Cyprus. We owe so much to him. Until his retirement, Dr. Agostinotti served as director of the pediatric department of Archbishop Makarios III Hospital and Thalassaemia Center. He also served as a consultant and advisor in hemoglobin disorders in Eastern Mediterranean region. Since 2004, he has been medical advisor of the Thalassaemia International Federation, has published extensively on hemoglobinopathies and thalassemia. We owe so much to his contribution. So, from island's roots to global impact, the Thalassaemia story, I hold Cyprus on a very, very high pedestal in the global impact and how they maintain thalassemia. And as someone who lived here, I know exactly what that is like. So the first question is for Dr. Michael. The global landscape and the Cyprus model. Cyprus transformed the thalassemia from crises to control and inspired the world. Cyprus is a pioneer in thalassemia prevention and care. It is often described as a global model in thalassemia. Dr. Michael, what made this success possible?
It's a very dangerous question to ask to an elderly gentleman like me, because if I start talking history, it'll take me all day. But dear Maria and dear Diaspora, I think I should remind you that Cyprus, being an island of actually educated people, it's not just thalassemia. We've won, if you like, many battles for the world. Cyprus became the first country in the malaria belt to become malaria-free, 1948. We competed with another island called Sardinia, and we beat Sardinia at it. They actually had to send us, the Sardinians sent us a barrel of wine to celebrate. We actually beat Australia in the control of hydatid disease. And I can tell you more. So there is a tradition in Cyprus of responding to health challenges. Now, thalassemia obviously is one of the major challenges, and it was one of the most difficult to deal with. I have to take you back to what life was like in 1960. In the 1960s, and indeed in some parts of the world today, thalassemia is a lethal disease of childhood. Most patients were born in those days and were not alive by the age of 10. So, and this was highly felt in Cyprus, more than other populations. Why? Because of the high frequency of the thalassemia genes that we had. It was very common. So in every community, in every village, everybody knew that in some families, children died very young. This was the first issue that we were faced with. However, I arrived in Cyprus in 1970, and there was another issue. It wasn't just the fact that people were dying. This was the era when we were waking up to the fact that thalassemia might be treated. And what we experienced in 1970 was that in the late 1960s, more and more children were not dying. They were surviving because of blood transfusion. And not only that, some doctors abroad and some doctors in Cyprus actually believed that we might even do better than that by giving iron chelation. So this was an era where death was dying out, life was beginning to loom, and what everybody in Cyprus actually realized that we can do better. And the Cyprus government, then the Ministry of Health, asked for help from WHO. What can we do? And WHO actually chose somebody from the Greek diaspora, one of the greatest names in the development of molecular biology, not only of thalassemia, was George Stamadogiannopoulos, George Stam in America, a very successful scientist in Greece who later settled in Seattle. George came to Cyprus in 1971. I was a young doctor then. I was one of the people who helped him to gather data. And we were able to show that children were actually surviving. And what we began talking about in those days was, if children are going to survive, that means that we're going to need more blood donors. And we have about 70, 80 new births per year. If we have survival as well, then the number of patients is going to increase year by year. We won't be able to find enough blood donors. We won't be able to find enough money for our chelating agents. Therefore, prevention became a necessity. And this is where the Cyprus model begins developing. Very briefly, George Stam, as a consultant of WHO, helped us put down a plan. We started off as a committee of about 3 pediatricians at the time, Hadjimenas, Psyloinis, and myself, and we started developing a program of screening, identifying carriers from school age. We were doing school leavers at the time, with the idea that we were going to be able to give them genetic counseling, and maybe they wouldn't marry another carrier, so that we would prevent things. At the same time, I don't know how it got round, but everybody in the world seemed to know that something was happening in Cyprus. And from London, Bernadette Model came. From California, Y.W. Khan came, another great Chinese scientist of the fathers of the molecular biology. And we had the opportunity to learn, we had the opportunity to discuss, and we gradually introduced prenatal diagnosis. And that's when I was trained in London for this. What we began understanding was that it wasn't what we said, it wasn't the policies that we decided on, but what the people responded to. And one thing that the young people of Cyprus taught us from the beginning was that they did not care about genetic risk. They wanted to marry who they wanted to marry. And they continued marrying even though we told them that they had a risk. They adopted prenatal diagnosis when it became available. By adopting, this was their first choice. And not only the younger people that were getting married, but actually the people that were already married were coming for prenatal diagnosis if they had a risk. So our success was actually our education program to the people, and the fact that we were counseling individuals. So this is how the Cyprus program developed. it succeeded, and by the 1980s, we actually 1 year hit 0 births. And this is the Cyprus model. It developed not because we had good policies necessarily, but because the people chose policies that we followed. This allowed us one other reason for success. As a pediatrician, when I came, I wasn't focused on prevention. I was focused on how my patients could survive. And of course, prevention became one of the tools which gave me the opportunity to manage my patients. We increased our, if you like, our contribution to our patients year by year. And in fact, we have arrived now to the point where Cyprus has one of the oldest thalassemia patients in the world.
The slide, you can see how prevention, the reduction of annual affected births, the red line on the top is what the annual affected red births would be expected based on the carrier rate, the population of the people. The blue line underneath is what was actually happening in terms of affected annual births. Of course, indicating and demonstrating the effectiveness of the prevention strategy that was followed. And this slide, the second on this circle, is the age distribution of patients, male and females, across Cyprus, which mean age is the biggest globally. We've got the biggest age, mean age of patients across the world, demonstrating, of course, the quality of care. Thank you.
Thank you for pointing that out. And now we're going to go on to the global progress.
Well, yes.
So TIF, a lot of people don't know this, is in 69 countries. A lot of people think that thalassemia is still a Mediterranean anemic disease, but it is in countries like Yemen and Pakistan and Malaysia. So Dr. Anjula, as the leader of TIF for 20 years, how have you seen the organization impact and influence grow? What are the biggest operational barriers globally?
Well, thank you very much. First of all, let me congratulate the diaspora meeting. That is very, very complex and very, very beneficial kind of communication and bridging gaps and cultures and ethics around the world from our people, from our own people who can understand us. So also I have to comment on Maria because she's one of the best patient advocates, and therefore we need to add to what Dr. Michael Angastiniotis has historically described the story of how thalassemia was built in Cyprus, and now we are as best practice around the world. But there was a huge contribution of the patient's voice. That's why I'm mentioning Maria as a patient advocate, because in all this puzzle of getting Cyprus to address the biggest medical, social, economic, and public health issue that had to face during the history, the patient's voice and advocacy for better treatment, for quality care, for living, for extending life at the beginning, when knowledge around how thalassemia was behaving and what were the expectations for survival, the first thing was that the patients and their parents, because patients were at young age then, so they united with the church, the government, the healthcare professional, and the community at large to bring out these changes. And it was countries like Cyprus, only another 2 countries had actually started addressing the huge public health and social repercussions that this disease would bring if not appropriately prevented and management. And these were Italy and Greece. So that was how Thalassaemia International Federation was created, because a handful of patients, parents, and treating doctors at the time in Cyprus, Italy, and Greece. Furthermore, and to a lesser extent, United States and United Kingdom that traditionally hosted migrants from these countries where there was high prevalence of these disorders, thought that what we have gained from our program in Cyprus, Italy, and Greece, we have to pass on and transfer this knowledge and experience to people around the world, because by 1985, when Thalassaemia International Federation was established constitutionally in Cyprus, because of obvious reasons, because of the huge contribution of the Cypriot doctors, patients, and the governments. It was agreed that constitutionally this federation would exist in Cyprus, but there was so much knowledge gained by then on the geographic dimensions of this disease, well beyond what was previously thought as geographically confined to the Mediterranean countries, to the Mediterranean Sea, hence the other name Mediterranean anemia, or even thalassaemia, which are two combined Greek words. Thalassa and anemia, the anemia that occurs around the countries of the sea, and they meant the Mediterranean Sea. Of course, we have Cooley's anemia as well because of the first descriptions in literature of the pediatrician Ali Cooley. But getting all that knowledge and experience of the Cyprus model, Italian and Greek, then these people have brought together the idea of passing on this to the rest of the world, because they then knew that the disease was spread across the world, and mostly in malaria endemic or previously endemic countries, because there's a connection between malaria infection and the carrier rate. So people who carried the disease were resistant to malaria, so they used to live, versus those that were not carriers, infected by malaria and died. And therefore, the carrier rate in these malaria areas was increased, and World Health Organization had then recognized that all these malaria endemic areas, which is the rest of the world apart from Western world, so more than 80% of the population with these disorders actually are born and live in these parts of the world. So the federation was established, first of all, to pass on the knowledge that was acquired from Cyprus, Greece, and Italy, but also to continue empowering research to continue, because it was recognized that people were surviving, people were living, but there was a limitation in their quality of life, in the development of medical complications. It was recognized that there was a need to further improve research. So with these two components, to further empower research for better care in Cyprus, Italy, Greece, and to pass on that knowledge across the world, the federation was established. And of course, with remarkable results. And I'm very privileged to have been the director of this federation since 2005, because I have seen it growing. I have seen it giving to the people the knowledge, the awareness, and the education, to the healthcare professionals, to the patients and families, to the decision makers, to the researchers, to the academia. We are the first patient-focused organization that has actually undertaken the mandate and responsibility of developing guidelines. No other patient organization has ever developed clinical medical guidelines for managing these disorders, which are genetic, hereditary, and very complex in their management. Therefore, when we started in 1985, when this international body was established, the knowledge was very confined around the world, apart from these 3 or 4 countries of the Western world, very confined. And when people ask, what what's the impact of TIF across the world? The first and most important is the spread of awareness. Almost everyone knows about what thalassemia is, how it's treated, how it can be prevented. The healthcare professional knows how to treat because we've got guidelines and we've got protocols that can be adopted. We've got barriers, yes. The barriers are, of course, the health priorities of the countries, the infrastructure of their healthcare system, and of course, thalassemia may not be a priority in many countries, as a lot of countries for many years and still are fighting against communicable diseases, infectious diseases. And that is a priority to address in every country effectively before you go on to address chronic diseases. Therefore, when we are asked, well, since we know how to treat and how to manage, why isn't thalassemia effectively treated across the world? It cannot be, because healthcare systems are different, resources are different, health priorities are different, and therefore what this federation is doing is continually fighting to spread awareness, to let the decision makers know that treating such a disease is not just treating a chronic disease, because you can build on this disease to build a number of other health infrastructure and services. For example, blood donation, as Dr. Michael explained. In Cyprus, we were the first country to build blood donation on voluntary non-remunerated practices, which long before CDC had actually announced that the voluntary blood donation is a huge contributor to the safety of blood. That was announced maybe in 1990s, in 2000. But we had to establish voluntary blood donation in Cyprus and some other highly prevalent countries well before we knew, because it was a necessity. Therefore, a number of other services, vaccination, blood donation, are built while building policies for this disease. So when we talk about thalassemia, a lot of people say, but they're talking about thalassemia again. No, we are talking about a disorder, chronic disorder, on which you can build policies for other chronic diseases, for other genetic hereditary diseases, and you can build numerous services in the context of public health. Have I left anything behind?
I just want to add as well to that, TIF not only published the guidelines, the only guidelines for thalassemia in multiple languages, but they also published the nurse's guideline, and the nurse is the first frontline healthcare provider to the patient. Second is a hematologist. So it's just outstanding with this tiny foundation in Nicosia, headquartered here, encompasses around the world.
It is very outstanding, yes. The fact that no other medical association actually took this responsibility from us. This is really something that we're very, very proud, yes, because all the other guidelines are produced by the medical associations. Hemophilia, lymphomas, leukemia, the guidelines are built by the medical professional societies. But for these disorders, we were very privileged to have this mandate, and we'll continue to upgrade and update these guidelines. Diaspora can help us.
Yes.
And we pass on this message to you because we want to bridge, we want to build bridges and support in awareness, in sensitization, in integration into the decision makers in your own countries, where you yourselves have integrated productively into the indigenous population, and you are now eminent members of societies in the different countries. We can build up research funds for continuing research, and we were talking about clinical trials and innovation. That is a huge component that diaspora can help us go through.
in bringing on these global global progress, Dr. Michael, there's emerging challenges and huge inequities. The biggest challenge today is inequality, not science. So, Dr. Michael, with such great advancements in thalassemia and remarkable scientific progress, the existence of treatment options, medical guidelines that TIFF has published, what are the most pressing patient unmet needs today?
Maria, can I just, I do apologize, but this is what I would like you to read. This has been sent to us by Professor George Stamatogiannopoulos, and that is very true, every word. No government, no scientific body, and no international organization can even claim to have achieved what this federation, Thalassaemia International Federation, has accomplished. I think this makes us all very proud of being Cypriots, of being within the Thalassaemia International Federation.
Such a great image. So.
Sorry.
Thank you, Michael.
Oh, Ellen.
You're talking about inequality. Yeah. Of course. The fact is that to manage thalassemia is quite a complex disease. It starts from infancy and goes to old age. To do this, you need to have blood, adequate and safe. You need to have a variety of medications, some of which are very expensive. You need to have expertise. You need to have specialized centers. You need to have technology like MRI and others. Therefore, it's not surprising that many countries in the world have thalassemia but are not able to deal with it. This is inequality. We usually say to ourselves, inequality is because of lack of resources. And that resource-rich countries always have good treatment. This is not the case. This is not the case because some of the richest countries in the world don't have the expertise. They don't have the numbers, they don't have the expertise. Most of the countries that say they don't have the resources, yes, they do have challenges because of many other challenges to the health of their populations, but basically it's not just resources. It's also lack of organization, and this is what the Thalassaemia International Federation is about. We encourage prioritization, we encourage organization, we encourage governments to develop policies that can be effective for patient survival. So, however, in this 21st century, we are reaching a peak. We're reaching a peak where thalassemia is now a curable disease, whether by gene therapy or hematopoietic stem cell transplantation, you can actually cure the disease, something we didn't have before. We have new drugs which can actually modify the prognosis of the disease. And all these have not benefited, but have actually increased the inequality for the simple reason that they're not accessible and they're not affordable to the vast majority of people, to the vast majority of the population that needs them. So if that's what you're asking, Maria, yes, inequality is getting worse, not better.
And particularly in healthcare systems that are not based on universal health coverage. This is a tremendous drawback in providing equal access to quality care. The healthcare system has to be based on universal health coverage if a chronic disease is going to be effectively managed. And we are living in an area of very impressive scientific advances for thalassemia and hemoglobin disorders. Never before.
Thank you. Thank you, everyone. Thank you.
Thank you for listening to Cyprus Diaspora Uncovered. Subscribe to our podcast on Spotify or Apple Podcasts for more inspiring conversations that are shaping Cyprus's global future. You can also explore more episodes on our website and selected video interviews on our YouTube channels.